Hi guys, welcome to my YouTube channel. My name is Hlalis and I am back with another video for you guys. Today I am talking about cervical cancer screening, pap smears, all those sorts of things. And so if you are interested in this topic, you better stick around to watch this video. And if you do enjoy it, please give it a thumbs up. Please subscribe to my channel and please click on the notification bell so that you are always notified when I post a video. So without any further ado, let us get on with this video. Alright, so I'm going to be answering a few questions that have to do with cervical cancer screening. The first question is, what is it? Okay, so cervical cancer screening, it forms part of a test that we do to check for precancerous changes in the cells of a cervix that can lead to cervical cancer in a woman. So the cervix is the mouth of the womb. So cervix is between a woman's vagina and the womb, and it's literally the opening to the womb. And cancer can form in those cells of the cervix. So cervical cancer screening, it's a test that is done to check for cells on the cervix that can end up being cancerous cells and lead to cervical cancer cells in a woman. And how is this test done? Okay, first of all, this test is called a pap smear, and it's done with an instrument that's inserted inside the vagina. And what this instrument helps the healthcare worker to do, your nurse or your doctor, it helps your nurse to be able to visualize your cervix, to be able to see how the cervix looks like, the cells of the cervix, and take some tissues with a brush that will be taken to a lab and can be tested to see how the cells are looking like, whether the cells are changing or the cells are still normal. So what happens in cancer is that cells, after a certain time, they don't die. So under normal conditions, cells grow, multiply, and after a certain time, they die. But in cancer, you will find that cells do not die when they're supposed to die, and they continue replicating or becoming more, and they start becoming abnormal and different from the normal cells of the body. So that's exactly what happens in cervical cancer. The cells of the cervix, they change their formation and how they look, and in their growth and multiplication, and they grow out of control. They form a tumor, and that could be a cancer. So as I said, when we're doing a pap smear, we insert our instrument, check the cells of the cervix with our eyes visually, and then there is a brush that we use to collect some cells there on the cervix that can be taken to the lab for testing. And right here I will insert a picture so that you can be able to see how the cervix is located, where it's located, how it looks like, and the instruments that we use to perform the pap smear. Alright, so who should do this test, which is called a pap smear for cervical cancer screening? All women in their reproductive age should do a pap smear. So you can do the pap smear from the age of 21 up until above 60 years of age. If you're a woman and you are sexually active, it's very important that you do a pap smear. And why am I mentioning specifically sexually active women? It's because It's been found that cancer of the cervix, cervical cancer, is caused by a virus called human papillomavirus and abbreviated HPV. HPV is a sexually transmitted virus that can be gotten through sexual contact, either skin to skin or penetrative sex. So this virus, it can go away. It sometimes does go away, but if it doesn't go away at a later stage, it can end up causing cervical cancer. So there are different types of strains or different types of this virus, HPV. On the one side, you have different types of this virus causing genital warts. Genital warts are also a sexually transmitted infection whereby a woman will be having lesions outside of her vagina or on her vulva that look like cauliflowers that are there. And then the other type of this HPV virus or strains of the HPV virus on the other side can cause cervical cancer. And it's been found that it's the strain 16 and 18 that can cause cervical cancer. So since it's sexually transmitted, every woman who is sexually active within those reproductive ages up till age of 60 can do a pap smear to be able to check for any changes in the cells of the cervix. So let me just clarify this again. HPV is a sexually transmitted virus or infection, right? It's a virus. It's the one that can end up causing cervical cancer changes, right? So you get infected with HPV, mostly it can go away. If it doesn't go away, at a later stage, it can end up causing changes in the cells of the cervix that can lead to cervical cancer. Alright, so how frequently should a woman do cervical cancer screening or pap smears? In the private sector, a woman can have a pap smear done whenever she would like to do it, or she can do it every 3 years. But in the public sector, a woman is granted 3 pap smears above the age of 30. So you can do your first pap smear in the public sector once you are above the age of 30, and you can have one every 10 years, which means that you can have one between the age 30 to 40, another one between 40 to 50, and then your last pap smear on at the ages of 50 to 60. And that is if you are HIV negative. So you have one pap smear every 10 years above the age of 30. If you are HIV positive, in the public sector, you are granted one pap smear every year. So you can have a pap smear done every year. And the reason for this is because people who are HIV positive, they are immunocompromised compared to other people. And if they are immunocompromised, they can get infections more easily. And so also the changes of the cells with cancer can happen more rapidly in them. So that's why they have to do their pap smears more frequently, which is every year. So how long would it take for you to receive your results after you do a pap smear? Anything from 3 to 6 weeks, you can get the results of your pap smear. And what those results will be showing is, are there any changes in the cells of your cervix? And the changes can either be classified as lower grade and higher grade. Lower grade changes would mean that your cells look fairly normal, and they might even go back to normal and would not cause cancer later on. But if your results come back saying that you have a higher grade change in the cells of your cervix, that could mean that those cells could become cervical cancer in the near future, from I think 3 to 15 years, if they are not treated or something is not done about those cells. So the whole point of doing cervical cancer screening is to detect any changes in the cells of the cervix while it is still early. And if they can be treated, or the changes can be made to those cells before they actually cause cervical cancer. So if you do have changes in your cells, the cells of your cervix from your pap smear test, it does not necessarily mean that you have cervical cancer, but it could mean that those cells have a potential of changing and later becoming cervical cancer. And I'm going to insert a picture here that will show the changes in the cervix depending on the lower grade and higher grade. So if they find that there are some changes to your cervix or to the cells of your cervix, you will be then referred to the hospital to do a colposcopy with a cone biopsy if it is needed. So a colposcopy is when they visualize your cervix much closer. They want to have a closer look at your cervix and how it looks and the cells. And then when they do the cone biopsy, they are going to take some tissues of your cervix so that they can look at them more closely and do a biopsy to check for cancer or to check for any changes that can show that the cells are cancerous. Okay, so just for interest's sake, let me speak a bit about the symptoms of cervical cancer, or what are the things that a person could see happening and that would kind of give them like a nudge that, okay, you need to do a pap smear. So if you've never had a pap smear before and you are having things like bleeding in between your periods, you are not on any contraceptive that can cause you to bleed into your in between your periods, and you are bleeding in between your periods, and there's so many medical conditions that can cause bleeding in between periods, but it can also be a sign of cervical cancer. So bleeding in between your periods, bleeding after sex, having a foul smelling vaginal discharge, or bleeding when you have passed menopause. So you're not supposed to be having your periods anymore, and you're menopausing, and then you find that you are still having bleeding. So those sort of things, especially in a woman who are like older, that could kind of be signaling a pap smear needs to be done, especially if you haven't done a pap smear at all. If you're having those sort of things, it would be great to ensure that you do a pap smear. Of course, there's so many other things that can lead you to have these sort of symptoms. As I said, contraception that you are using can cause bleeding in between periods. If you're having STIs, that can change your vaginal discharge. It can also end up causing bleeding after sex. But it is important that when you are above the age of 30, if you are having these sort of things, just make sure that you have your pap smear done so that you can rule out one thing, which is any cervical cancer. Okay, so now let's go on to the most important part of this video, which is how to prevent cervical cancer. So we're going to look at what are the sexual habit related things that people can do to prevent them from being at risk of getting cervical cancer. So number one, safe sex practices. That's definitely one thing that is very important for women to do. Ensuring that you have one partner, one sexual partner, being in a monogamous relationship, meaning that you are only with that person. It decreases your chance of getting this virus that causes cervical cancer, which is HPV. The less sexual partners you have, the lower your risk of getting infected with this virus that can later cause cervical cancer. Condom usage is also important because it can help, though it does not completely eliminate the risk of getting this HPV infection, because it can also be transmitted skin to skin. But it would also increase your chances of contracting the virus in some way. And then also doing an HPV test with your partner is something that can be done to see if you have the HPV, which can end up causing changes in your cervical cancer cells. And then another thing that's important, especially for girls when they're still young, from the ages of 9 to 12, they can get a HPV vaccine. And in the public sector, HPV vaccine is being given out to children while they are still at school. So this vaccination would help them to prevent getting the strains of this HPV virus that cause cervical cancer. And then, of course, something that is so very much important for women, especially after the age of 30, from any age actually, if you are able to go to the private sector to do a pap smear test, I would like to use this video to encourage women to go for pap smears. It's really important to check your cervix for any changes that can lead to cervical cancer. Cervical cancer is one of the most common cancers in women. So definitely it's very important for women to continuously check themselves to see if they don't have any changes in the cells of their cervix, especially if they are sexually active. So it's good to know where your health is, where you are as a woman. There's so many things that can affect a woman, but at least if you have gotten your pap smear done, you're eliminating one of the problems or things that you can end up having. So that's why I did this video. I really just want to encourage all women to go for pap smears. Cancer is really one of the diseases that are so gruesome, and oh my gosh, I really cannot emphasize how cancer is so destructive. And not only cancer can be it's not that cancer can only be caused by certain infections, like in your cervical cancer. It's not only caused by HPV. There's so many other things that can end up causing cancer to arise in our body. Things like our diet, things like exposure to radiation, things like smoking. There's so many things that can cause many different types of cancers in the body. So I'm a person that really believes in doing all that we can to prevent things from happening before they happen. So yeah, I really hope that someone benefited from this video. And if you haven't had your pap smear done, then you better consider having it done. Thank you so much to everyone for watching this video. I really hope that you enjoyed it and you learned something from it. And if you did enjoy this video, please do give it a thumbs up. Please subscribe to my channel and please click on the notification bell. Also, don't forget to share this video, because I believe that there's so many women out there that would appreciate this kind of knowledge and will be moved to do something to go get their pap smears done. So yeah, please do share this video with your loved ones, with your friends, with your family, so that they can also learn something and benefit from it. I love you guys so much, and I thank you so much for all the wonderful support. Till the next time, bye.